Good afternoon. My name is Victoria Sadovic. I am professor assistant at the University of Medicine and Pharmacy Nicolae Stimițeanu from Moldova, and I'm joining you from the EULAR 2025 in Barcelona. And today I have with me Professor Laura Andreoli from the University of Brescia and Dr. Liala Moschetti from the same university. Thank you for joining us today and for taking time to discussing with us. Today we'll be discussing about their session entitled Difficult to Treat Antiphospholipid Syndrome. Dr. Liala Moschetti, I would like to ask you, how would you define a case of difficult to treat antiphospholipid syndrome?
Well, at this moment, there is no clear consensus definition on what is difficult to treat antiphospholipid syndrome, but we can consider patient with antiphospholipid syndrome difficult to treat like patients with recurrent events despite the standard treatment. For example, patients with recurrent thrombotic events despite the antithrombotic treatment, and patients with recurrent pregnancy complications. Moreover, also patients with rare manifestation of antiphospholipid syndrome, that are those we're used to call extra criteria manifestation, we can consider them like difficult to treat.
Thank you. And in this case, Professor Andreoli, how would you treat patients which still have recurrent thrombosis despite anticoagulation?
This group of patients are very difficult to treat because basically we need to potentiate the antithrombotic treatment, and this may pave the way to some bleeding complications, so it's not easy to keep the balance when using oral anticoagulants at a high intensity, or when you combine oral anticoagulants with antiplatelet agents. So the most common approach that is also recommended by international guidelines is to combine antithrombotic treatment with immunomodulation. And for instance, a drug that rheumatologists are very familiar with, which is hydroxychloroquine, is kind of promising and is an additional option that we can offer to our patients with recurrent events despite anticoagulation.
Thank you, Professor, for your answers. This is indeed a very difficult situation and difficult to manage, especially for us young rheumatologists. But despite this, antiphospholipid syndrome can be very complex and it can manifest in a variety of ways. What do we know about renal antiphospholipid syndrome?
Patients with antiphospholipid syndrome can also suffer renal involvement with both macrovascular and microvascular involvement. In particular, the more difficult to treat renal involvement is the microvascular involvement. So rheumatologists or clinicians that take care of antiphospholipid syndrome patients should be aware of that and should monitor with the urine analysis and control of serum creatinine these patients. When some alterations are found, they should discuss it with the nephrologist in order to better manage these patients.
Yeah, sure, thank you. And looking ahead at the future, Professor Andreoli, what are the emerging therapies that are on the horizon that might help us in the management of difficult patients with antiphospholipid syndrome?
Yes, it is very important to apply new technologies to better understand the pathogenic mechanisms of antiphospholipid syndrome, and then be able to apply the huge number of targeted treatments that we have now in rheumatology. So basically, some biologics have already been used in the antiphospholipid syndrome, like rituximab was used for the so-called extra criteria manifestations, like, for example, APL nephropathy, but also skin ulcers or other difficult to treat involvement. But I think it's important to underscore the lifestyle modifications and the modifiable risk factors. So basically, before stepping up any treatment in APS, we must make sure that we have taken care of removing or minimizing other cardiovascular risk factors, like, for instance, arterial hypertension, high cholesterol, and so forth. But basically, yes, there is still much to learn about APS, and yeah, that will lead to more targeted and personalized treatments.
Thank you, Professor, for such a detailed and complex answer. Thank you for taking time for speaking with us today, and thank you everyone for being with us today. I wish you a great Congress ahead.